Rakhi, who is going to talk about how to start your research career from residency. So many of you think that those who have a lot of publications and papers, they have some extra this thing with them, that they are blessed in some way, but that is because they started from residency. Over to you, Raki.
So good morning everyone, I'm Dr. Rakhi D'cruz and I'll be talking on how to start your research, when and how to start. So what is the need for a research career? The research makes you stand out because in this era of digitalization, academic competence and survival of the fittest, you need something so that you can stand out. So this act like a stepping stone to a successful career and gives greater preferences for getting into fellowships in premier institute. For example, in few of the institute, they actually weigh your research. So for example, in LVP, if you have a 4 or 5 research papers already published during your residency, then you have a sure shot for that. And also gives you an opportunity to present at conferences, so you can be a faculty rather than a delegate. And once you get a publication in an indexed journal, the world knows your name, and it makes you wanted as an invited faculty if you have a large number of publications. It gives you recognition and acknowledgement among your peer groups, and by this you are actually contributing small to the scientific world of growing knowledge. So, when is the ideal time to start? So, I would say you have to start during your post graduation or during your senior residency, because during the and even in post graduation, when to start? Ideally, it should be started during the second year, because in the first year you are like an alien in the ophthalmic world. You don't even know the short terms, you don't know the diseases, so it will be difficult for you to start a research. So during the second year is the ideal time to start your research. But what really happens in our medical colleges and why we lack publications? So here what happens is that the priority is only for passing your exams, and even the OPD evaluation is all mentored towards passing the practical exams alone. There is a particular exam oriented learning. There is no questioning behavior coming from the residents, and there is a lot of unwanted clinical works and cases writing which takes up most of the time of the postgraduates, and they have reduced exposure to conferences, recent studies and upcoming medicines and innovations. And few colleges have mentors and teachers who are least interested in publishing papers. That is why not many thesis works are actually coming to the limelight. What happens in the Western scenario? The publication starts during the MBBS times itself. Publications are sort of mandatory for getting into a specialty or into a residency program. So you have to frequently upgrade yourself with CME attendance. So, before stepping into research, you have to think whether you are really interested in research. But are you really interested in research? How can you know that? So, first give it a try during your residency itself to know whether you are really interested in research or not. So, for that, you have to find out your subject of interest, whether it is glaucoma, retina, whatever, and find a mentor who has knowledge on how to publish rather than clinical knowledge on how to publish papers, and express your interest to him or her. A proper documentation, including photos and videos of all the interesting cases in OPD, is a must. For that, you have to walk with a research mind. Develop a habit of research paper writing. This can be developed only by reading journal papers. So first you have to start simple. Start with a case report. For example, I will tell you my example. So how I started was I was in the retina OPD just seeing a routine case along with my consultants. So that was an interesting case and I was also very much interested. So at the end of the day, so usually we have discussion only at the end of the day. At the end of the day, at evening 6 o'clock, I just asked a consultant again about that case and what happened and why it happened and something like that. So then sir understood that I am interested in such things, new things. So I was trying to ask for the reason behind that finding. So he also told, I also don't know the reason behind that finding. Let's find out together. So then the next day he came with some of the suggestions what I read in the research papers and all. So then he asked me, why don't you write a case report on this? So I was really, I didn't know anything about research during that time. So I said, sir, I don't have any exposure. I don't know how to write a case report. He said, just go and read some of the case reports that are there in the Indian Journal of Ophthalmology and try to write something and bring it back to me. So I just went and read one of the case reports, and I just copied their style. I wrote something and brought it back to him. But he was really impressed that I have no exposure at all, but I tried something. So there he guided me how to write better, and thus was my first publication. So you have to start. So for starting, it's always better to do a case reports or a photo essay. You have to express your interest to the right teachers. Don't be afraid of them. Go and just say. What if they say no? No problem. Let it be. So, so they'll guide you to find the perfect case which is worth publishing. And you have to, what you have to do is you have to follow up the case from head to tail and master the topic. Go and read, you do your own research and go and read about that topic. And you have to properly document and save everything in a pen drive. And then before writing, what you have to do is go and read similar case reports. For example, if it is a case of a CSR, something different in CSR, go and put the keywords of central serous retinopathy into PubMed and search all the case reports, recent ones. What all different types of case reports in CSR have been published. If you read like that, you will understand, okay, this is already published, so there is no point in publishing that one. Or let me try something else, maybe something like a difference in the treatment, something like that. And then when you're reading a case report, you have to follow their style of writing. Case reports are simply very easy. So for starts, you have to start with a introduction, a very short introduction. Then comes the case description, which is almost similar to how you present your case in your normal classes. Then comes a discussion, which is a main part. What you have to do in the discussion is that you have to tell about what was new in your case or what was different in your case from the other published cases, and just discuss on what all the recent published cases in the same scenario. That's it. So start writing small paragraphs each day, set daily goals, set a target, and finish on time. Share your first draft to your mentor and ask for edits or changes. Then you have to go back and find more recent articles, and review papers are the best. And that will help you to strengthen your literature review. Then you can start learning the referencing style. Learn the reference styles. Different journals have different referencing style. You have to learn that also. So once you get a publication, the pleasure of seeing your name in an index published publication, that is the ultimate blissfulness for me. So then it is like I'm determined, I'm focused, I'm courageous, I'm victorious. So I'm unstoppable. So that's where you get the energy drive. Then you can focus more on proper papers. So when you start with papers, retrospective is the best. But when you're going for prospective papers, you need IRB approval. For that, you have to write protocols. And for this, your thesis work can help. Then you have to start collecting data into Excel forms. So for that, you need to learn the basics of Excel and statistics. Learn references managers. EndNote and Zotero are a big help. Then learn language tools, language editing tools. Grammarly has a free version and it's very easy to use. And you have to start learning statistics if you're going to do it on your own. Stata is the one which is being used by most of the statisticians. Attend research methodology workshop. There are so many available. One by Dr. Sengupta sir is actually very easily you can enroll into it, and it's at a very minimal cost. And there should be a willingness within you to give you a research time every day. Then when you are further moving, how to find the research questions. So you have to find the lacunae in the already published papers. So you have to go and look in the limitations that are mentioned in one study. So that can be the research question for the next one. Then after that, formulate multiple hypotheses and go and meet your mentors. They'll tell you the right direction to go for. Never, and once you're publishing, never copy paste anybody else's work. Run proper plagiarism tools. Learn about authorship criteria, how to give credits, who should be the first author, who should be the corresponding author, and all that. And you should take consent for whatever images you are using from other papers. And if you're taking a patient's photo and using that also, you should make sure you should take the consent. So I was also very normal like you people, started in my residency. I had a few publications during my residency, but once I got the publications, I kept it alive. Even now I'm trying to do it. So these are my publications. This is something simple. If I can do it, you also can do it. And this is actually very important for our future. Thank you.
Thank you, Rakhi, for that extensive talk. And I think all postgraduates, please note that it is never too late to start. I didn't. If you want to guess the number of publications that had at the end of my residency, it was zero. Okay, so my publication started only towards the end of my fellowship. So it's never too late to start, but start as the earliest you can. And and of course, you have Zotero and all those reference managers. Citation is one of the difficult, boring parts. Learn to use